Hey, it's me, Dr. Wendy Goodall McDonald, here to talk about PAPs. What's a normal PAP? What's an abnormal PAP? How do you know the difference? And also, what does follow-up look like? What are our regular PAP guidelines these days? What is it all about? I mean, it's about time because I've been waiting for you to tell us what we need to know about this PAP situation. I'll get to you. Yeah, I've been waiting too because I need my PAP. I'm not with the foolishness. I'm not falling for the okie doke. I need the PAP, okay? I don't like it, don't get me wrong, but okay, we'll talk about that too. I need it. Okay, slow up, we'll talk about that too. I mean, because if you tell me I don't need a PAP, I'm not getting it. I hate them. Am I gonna be able to talk? No, but I've been waiting for you. So finally, break it down. Thank you. So, the thing about Pap tests is basically it's looking for abnormal cells on the cervix. So the cervix has cells which have a cell wall, internal cytoplasm, which is like the fluid, all these different components, and then the nucleus. And if the nucleus starts to get bigger and kind of abnormal, it can become precancerous, and then ultimately a person can develop cervical cancer. All this comes from the virus HPV, which I might talk about in a different video because HPV is a whole different subject. It's not a different subject, it's related, but it's a lot to talk about in one video. So when we do the PAP, we actually are doing a test of this part of the uterus, which is the cervix. So the cervix is connected to the uterus. We take a brush, we swab it, and it tells us what those cells look like. Now, why did the PAP guidelines change? Why do we not need a PAP every year if you've had normal PAPs? It's because those cells change really slowly. Like from an abnormal PAP to cervical cancer, it's gonna take years. I'm talking about probably close to a decade for most people for that abnormality to go from normal to cancer. And so it just kind of is one of those things where we just don't need to see and look at the cells as frequently anymore. That guideline changed back in 2009 originally, and then it was reaffirmed in 2013, and more guidelines have kind of changed since then, but that's when we first started seeing that PAPs were not needed every year. The same practice takes place with colon cancer screening, because colon cancer screening doesn't need to happen every year. But for some people, if the cells are slightly abnormal or the polyps, they may need a colonoscopy in 3 years or 5 years. But some people don't need colonoscopies except for every 10 years. We're not doing colonoscopies every year because you just don't need to. And the same is true for the cervical cancer screening, as long as your cells have been normal. What's the downside to doing a PAP if you don't need it? One could say, well, there's no downside, just check. Well, there is potentially a downside. The downside is most people who have abnormal cells, even if they're just slightly abnormal, those cells will go back to normal on their own for most people. And so if you do a PAP and a person's cells are normal, and the next year they're slightly abnormal, we have to follow that up. We can't ignore that. You have to pursue evaluation, something called a colposcopy, which is where we look at the cervix a little bit more closely. We have to do that when we see an abnormal PAP. But then the next year, for some people, that PAP will be back to normal. So the person who didn't get their PAP every year, that got their PAP in 2 years or 3 years, or even for 5 years for some people, they may have avoided that further intervention when things would have gone back to normal on their own. And they didn't need to have that further testing, they just didn't need to have that further testing. So that's the downside. The downside of not getting your test is that there are those abnormalities that occur or move faster than we think, right? So most people, if they're going to go from normal cells to cancer, it's going to take years and years. For some people, it may take 3 or 4 years, I guess, is possible, versus 10 years, right? So the person who says, well, just do my PAP anyway, yeah, you're being vigilant, and you are kind of making sure that everything is okay. But again, it's not wrong to skip years. Different PAP, the guidelines are pretty static that you can do a PAP every 3 to 5 years, depending on if you're doing HPV testing or not. I like to offer PAPs every 2 years to my patients just because I've seen some things that make me like to do them every 2 years, but that's provider dependent, and guidelines are just that. They're guidelines. They are suggestions. They are not rules, static facts, and most insurances will still cover a PAP every year. But I tell my patients all the time, you don't need a PAP every year, especially if their PAPs have been normal. Now, what if you had an abnormal PAP? Abnormal PAPs usually, depending on what kind of abnormality it is, will warrant a colposcopy, which is that closer look at the cervix, and then another PAP in a year. You won't really see any guidelines at this point that say do any further testing in 6 months or 3 months. kind of gone are the days where you need to do a Pap every 6 months or Pap every 3 months. That's just not standard practice anymore. That if you do the Pap and it's abnormal and you need a colposcopy, you do that. And then if things are okay and you don't need to do further testing or further intervention, you can actually usually repeat that Pap in a year, an entire year. What's further intervention? Say things are actually trending toward cancer. They're moving more toward that abnormality. Then you may need to have a LEEP, which is a removal of a component of the cervix. So it's a loop electrosurgical excision procedure, which basically means you take off a part of the cervix, a really small part that is trending toward cancer. It's better to get that out of there and stop it in its tracks than to leave it there to cause more problems. But that's not the typical trajectory. Most people who have a slight abnormality on their cervix, it will go back to normal. What are some things you can do to help it to go back to normal? I tell my patients, look, eat your vegetables, your green leafy vegetables in particular. Get your sleep, manage your stress, take care of yourself, take care of your body, because that will support and encourage your immune system to fight that HPV virus, which is the problem. HPV is the problem, and we want to get that out of there and get your body to kind of go back to normal. So I tell people, do your best to take care of your body. There's not a magic pill. There's not a magic medication. If you see something on the internet that says, take this magic medication, it'll make your cervix go back to normal, more than likely it's not a thing. I mean, apart from like chemotherapy for cancer, but to manage a cellular abnormality on the cervix that's not cancer, there's not an evidence-based way to do that. I hope this has answered your questions. Drop some questions in the comments and I'll make a follow-up video, because PAPs, I could talk about PAPs forever. I could talk about PAPs forever, and I could explain it and go over it and even go more in depth as to like what the cellular changes are and what kind of management guidelines are, and how an atypical cell PAP is different than a low-grade PAP, which is different than a moderate-grade PAP, which is different than a high-grade PAP, which is different than a carcinoma in situ PAP. Like, we can talk about all this stuff, but I'm just not going to keep y'all here all day on this video. So let me know what you want me to talk about next, and I will definitely make a follow-up. Thanks, bye. Are you happy? Yes, Doc, thank you for explaining. Are you happy? Yes, I'm happy. Thank you.